Hi everyone, I'm here with Ms. Chavez at Family Practice Center.
Hello everyone.
Today we're going to talk about one of the most common conditions that we suffer in the RGV, and yes, we're doing it again, it's diabetes. We tend, especially here in the RGV area, it's because of the diet that the Latinos follow that we tend to suffer, or we're more prone to developing diabetes. Okay, so don't get offended. Yeah, Ms. Chavez, can you remind us again, what is diabetes?
Okay. Diabetes is it's a disease that results from too much sugar in the blood.
Okay, and as a doctor, what are the things that you do to follow up with the patient and their diabetes, to regards like what type of medication they should use, or how should they improve their lifestyle? What do you do to get their status on diabetes? What type of exams do you do?
Okay, we check the fasting blood sugar, and we also check for the hemoglobin A1C. That we and the kidney function. So we do that every 3 to 6 months. It's very important for patients with diabetes to get regular checkups. So when we do blood work, this is what we're checking for, because with diabetes, diabetes affects all your vessels in your body and your arteries. So we check for all that every 3 to 6 months. We also do a yearly eye exam, a yearly foot exam, just to make sure that they're not suffering from neuropathy or blindness.
Of course, due to diabetes, like one of the effects. What about the blood pressure?
Yes,
is
we
it
check
important?
for the blood. Yes, it's very important. So we, for diabetic patients, we want their blood pressures to be less than 140 over 90. It's very important, and we ask this, or this is what our goal is, to protect the kidneys. That's basically what we want the blood pressure to be below 140 over 90 to protect the kidneys. As well as cholesterol, we check for their cholesterol levels, because that also has to be monitored, because with diabetes there's a higher incidence of heart disease. So we check the blood pressure, we check the cholesterol, and the blood sugar levels. Okay.
Well, talking about sugar, we might tend to confuse sugar, the good sugar, against the bad sugar. We, especially here, we eat a lot of carbs that they turn into sugar. But what do you recommend for a diabetic to eat when they're suffering from the condition?
Well, I always tell my patients that they need to really monitor their carbohydrate intake. Carbohydrates are anything that turns into sugar, basically rice and
white flours.
Yeah. Anything that white bread.
Okay.
Pasta, things like that. So
all the good things that
we love.
Yes. And what do you suggest for them to switch instead? Like, for example, if I'm carving bread, what should I eat? Or like
substitute the white rice for brown rice, a wheat bread instead of white bread, brown pasta or the wheat pasta instead of just a regular pasta.
Okay.
Things like that. Eat more fruits and vegetables. Substitute that, instead of having more carbs
chips or
things.
Yeah.
Right. So substitute it with more vegetables and fruits.
Okay.
The fruits also have
they also have sugar.
It's fructose. So it's a healthy sugar. It's also sugar, so you need to
you still need to have
in moderation as well, but it's a better sugar for you than sugar that comes from candy or comes from sodas or anything like that.
Yes, especially sodas, that they have a lot of sugar in it. Yeah.
No sodas.
No sodas.
No sodas.
Especially the Mexican Coke.
Which is the best one, but
it tastes good, but
in moderation.
Yes.
Everything in moderation.
Okay. Another question is, most of the people that suffer from diabetes, they suffer also from overweight. What can you recommend for them to improve their weight and also help with their sugar levels?
Exercise. I always tell my patients, exercising, walking, dancing, swimming, anything that
That has some activity.
Increasing your
body.
activities. A sedentary lifestyle basically means that you don't exercise. You need to get up, walk around, be active. I always tell my patients to walk. Walking is the best exercise, I think. Do that 4 to 5 times a week.
And even doing it 20 minutes, it can improve a lot.
For 30 minutes, 30
health.
minutes, it really does help. It helps bring down your blood sugar. It helps bring down your blood pressure and your triglycerides. So exercise it's great.
Walking has a lot of benefits, especially when you do it outdoors. It's not only for the health, but it can also improve your anxiety, your depression.
Exactly.
A lot of good things. There's a lot of benefits from walking. Thank you very much, Ms. Chavez.
You're welcome.
You can come and see her here at Family Practice Center. She's here Monday through Friday from 8 to 5. You can set up an appointment with her. She's very good with her patients. So you can call us at 956-668-0044 or visit us at 501 N Ware Rd in McAllen, Texas. Thank you.
Thank you. Bye-bye.